Okay, good morning, everybody. It's 10 o'clock, and we're going to go ahead with this first committee of the whole, dealing with three bills which we have retained this year. They all address the same topic, mental health in our schools. A very, very important topic. In front of everybody here on the committee, you should have a copy of the agenda. It basically gives our presenters, the presenters that are going to be working with us today, and how we will handle the Q&A, the questions and answers. We'll have a short period following each presenter, but then we're going to have a 30-minute period following at the end so we can wrap things up and really steer this ship in a direction that we want to move in terms of how we're going to address these three bills. This is a huge topic. It's a topic in which I've been engaged just the other day when we had the teacher shortage committee. That topic, mental health in the schools, popped up just like that. When we had the trustee meeting for the University System of New Hampshire, that topic was right on the table for the 27 trustees of the University System of New Hampshire. When we had our oversight committee here back on June 12th, which you have a copy of the docket which we had there, mental health was one of those issues which we addressed there. So it's a topic which I think it's apropos that we be looking at seriously here and trying first to identify what is this, what are we talking about, and how are we going to handle it. And I know that when the bill was introduced at hearing, I had a conversation yesterday with Senator Waters and DOE together, dealing with some of the questions. And I think I'm not going to mention anything right now because this will all come up probably in our discussions today. I will let everybody know that I do have a conflict here. This meeting was initially supposed to have been in the afternoon, but it got in the calendar at 10 o'clock. I have a meeting starting up at about 11:05, or supposed to start at 11 with Senator D'Alessandro and Senator Carson dealing with civics education, which we know we have another issue there. We appropriated $1 million for a program this year. And so we're addressing that somewhat. So I'm going to have to get up and leave, but I've asked Representative Myler continue with the meeting when I leave. Mel has been the chair here and ranking person. He's been the chair of this committee. I don't know which year it was, Mel, but it's dating back on our time here together. And he is also the ranking rep, and I think it's very appropriate that he be here, seeing that the vice chair is not here today. So with that, I'd like to look at the docket which we have here. And for those people which are here, can we go around quickly and introduce ourselves? Because we have Kendra Lewis here from the University System of New Hampshire, who is working with a cooperative extension service, which is dealing with youth and family resilience programs and first aid and all that as associated with mental health in our schools. And we also have Melissa White and Rebecca Fredette's not here today. But Melissa is very much attuned to what's going on in this domain, this curricular element, and also familiar with the MTSS-B, which we have discussed in previous. And Jane Bergeron, of course, is a frequent flyer here from the School Administrators, Special Education Administrators Association, and will also be presenting to us today. Why don't we start with you, Representative Balboni, on that side, and wrap around, just introduce yourself, and then we can get going.
Representative Peggy Balboni, and I represent Rye, Greenland, and Northampton.
Okay.
I'm Representative Corrine Cascadden. I represent the City of Berlin.
Hi, I am Representative Valerie McDonald, and I represent Salem.
Representative Katie Peternell, I represent Wolfboro and Tuftonboro.
Linda Tanner, I represent Sunapee and Springfield.
Dave Luno, Hopkinton Bow, Concord.
Mel Myler, Hopkinton Bow, and a part of Concord.
I'm Rick Ladd. I come from Haverhill, New Hampshire, and some of us are from the North Country.
Oliver Ford, Chester.
Kristen Noble, Bedford.
Good morning, Muriel Hall, Bowen, Hopkinton.
Good morning, Hope Damon. I live in Croydon. I represent Ackworth, Langdon, Leominster, Goshen, Washington, Springfield, Sunapee, Croydon, and Claremont.
I have the
remember one. Steve Woodcock from Conway, glad you're here, thank you.
Margaret Drive from Plainfield. I represent the rest of Sullivan County, so it's Plainfield, Cornish, Newport Unity, and Charlestown.
Alicia Lekis, Hudson and Litchfield.
Well, thank you. We have coming up first, we have Kendra Lewis and her cohort there. From the Extension Service, they presented a short activity which really got us thinking about mental health. By us, I'm talking about the 27 trustees of the university system last week. And mental health was one of the issues which was, aside from talking about the lakes and the rivers of our area and the drones which are flying over top, mental health surfaced. And so with that, I'd like to recognize Kendra.
All right, thank you. I'm glad to be here. I'm gonna let you stand up and pass some stuff out. Yeah, so I brought my supervisor here and helping him help me pass out some stuff. So if for those of you who aren't familiar with Extension, we're the outreach or part of the outreach arm of the university, and so we focus on health and well-being. Mike here's our wonderful team leader. I'm a state specialist. We approach health in a holistic manner, so we cover nutrition and physical activity, and also then mental and behavioral health. And mental and behavioral health is my passion and my expertise. So we shared with our board of trustees an activity on mental health first aid. Just to give you a little idea of what Mike has passed out, there's a rack card that says Aging Well. That's just to give you an idea of some of the programming that we do in health and well-being and extension. We have an aging population here in New Hampshire. We're growing very quickly with our aging population, so we have a lot of programs there. You'll also see the 5 healthy habits for mental health. That's from the Department of Education. I just feel like that's always a nice little flyer to keep handy of, quick tips to help take care of you. And then the last is a handout that's very quick about, UNH Extension in general on the front, but then on the back, again, it's talking about mental health and well-being, really focusing on mental health for youth. So many of you are probably familiar with the Youth Risk Behavior Survey data, right? And sadly, we've seen the rates increase in that we don't want to. So approximately 25% of youth have seriously committed attempting suicide. 36% or more have reported that their mental health has not been good most of the time or always, and that's compared to a national average of 29%. And at least 10% of our New Hampshire youth have attempted suicide at least once. And all of these rates have gone up a lot, especially during COVID. So this was data that was collected in 2021. And so it's quite a big increase that we saw from the data that was collected in 2019. So I'm going to talk about one of the programs we offer that's on the Aging Well, but it's also to focus on youth mental health. How many of you have taken the Youth Mental Health First Aid course? No, at least one of you. Anybody back here? Okay, we got a couple people. Great. Yeah. So mental health first aid, we've an Extension have been delivering this course since 2016. In 2021, we kind of became a hub for the state through funding from the Department of Education. We've been working closely with the Bureau for Student Wellness on that. They were sort of the hub that kind of came to us. And so as a hub, what that means is that when an organization wants to take this course, they can come to us and we'll help them get connected with trainers in the state. So mental health first aid is an 8-hour course. It helps us learn how to recognize signs and symptoms of mental health challenges or maybe a substance use challenge and help somebody get the care that they need in that moment. If you think about it like CPR for mental health, that's an easy way to think about it. So CPR, right? We see somebody having some sort of physical health challenge, we give them CPR, and then the medical help comes and arrives, and our job is done. Mental health first aid is similar in that we see somebody having a crisis, we help them through those moments, we get them, whatever help that they might need, and then the appropriate medical professionals take over. So there's a couple different versions. There's an adult version, which is what's on that card. So that would be adults like myself. And I take the course so that I can support my adult peers. There's a youth version. And so this would be, again, for adults that want to support the youth that either, maybe it's the youth that they work with. It could be the youth that they live with, care for. It could be, you know, a youth that they see in a grocery store, maybe having a crisis. There's also a teen version where teens learn these skills so that they could be help for their peers and then help that teen find an appropriate adult who can help them then get the services that they need. So again, we serve as that hub in the state, getting people connected to instructors. So schools can come contact us, say, hey, we want to have a training. We try to find them some local trainers that can come do that for them. Or if you're just an individual who's interested in taking the course, we offer them monthly so that anybody can sign up and take the course as an individual. So you don't have to be tied to a specific organization to take it. This course is literally for anybody. We've trained lots of schools, different school districts. We have one school district, Groveton. Anybody who represents Groveton here? Is anybody here? Close? Yeah, they trained all their bus drivers. They, so the bus drivers are, somebody who obviously they see youth. So they wanted to make sure that their bus drivers were able to see, because they also see different parts of students' lives than teachers and other school staff would. Public safety officers, especially in the Dover area, they've been training all of their police officers, sheriffs, all their city workers. We have librarians across the state who have also been trained, and we're working with the community mental health centers as well to, help them train people in the community who want to. So we are going to do an activity in just a moment. Again, this course is 8 hours, so it starts by teaching us what are those early signs and symptoms if somebody's just starting to have a mental health challenge, what are maybe some signs and symptoms of people who are getting a little bit worse, and then people who might be actually experiencing a crisis. What do you think some of those signs and symptoms might be from anywhere along the continuum? Symptoms someone might be having a challenge. Yeah.
Changing behavior.
Changing behavior, yes. What else?
Being withdrawn.
Being withdrawn, yeah.
Substance abuse?
Substance abuse, yep. Yeah. Anyone back here? Sorry. Yeah. Yes, go for it.
Over or under eating.
Yes, yeah. Changes in eating. Yes, changes in eating is a big one. Yeah. So there's all these signs that we could be seeing, and so again, the course goes through what are the ones that we might see kind of early on. What are those ones that are, oh, this is getting a little bit worse, and what are ones that we see when somebody is in crisis. So this program is really good as an early intervention when those signs and symptoms start showing up and trying to stop it from getting to that crisis mode. Let's catch what are those early symptoms so we can try and get somebody the appropriate help so that they don't go into crisis. But it still prepares us to know what does it look like if somebody is in a crisis situation. People learn an action plan. It's got a cute little acronym called ALGE, so they can learn, how do we assess the situation? How can we listen non-judgmentally and really validate what somebody is experiencing and give them the assurance that they need in that moment? Encourage the appropriate professional help, and then encourage them to also take care of themselves, because this is really emotionally taxing for us to be providing that mental health care to other people. So how do we make sure to check in with ourselves and take care of ourselves there? So we're going to do an activity that we're jumping towards the end of the course, and we're going into crisis mode. We're going to do an activity that is an auditory hallucination. So we're going to kind of get an experience of what it might be like for somebody who is experiencing auditory hallucination. So we can kind of build a little empathy there and have that. So I've got two people who've been voluntold by Representative Ladd. So Representative, is it Kaskaden? Oh, you've been voluntold, and you as well, Representative Woodcock.
You're welcome. Ahead of you.
Okay, that's all you're going to do is be reading this. You can come here. It'd be great. 529. He's 529. Sure. Yeah. So you're gonna maybe if you two stand right there in the middle would be great. So. Your job, Representative Woodcock, is to listen She's going to be reading to you how to get to the new library in town. And your goal is to get to the new library in town. I am not going to make this easy for you. But your job is to try and get
Should
there.
I have some distance?
No, you'll be okay. You'll be okay. So you're just going to read this part and you're going to do your best to get to the new library in town. Go for it.
Ready? The new library's amazing. You're almost there.
Why are you talking to her?
Just a little bit to go.
Don't trust
Start
her.
out going west on Owen Ave.
Is
towards
she looking at you?
Then after half a mile, turn right.
Why
on
do
Park
you want to
Street.
talk to her?
If you don't know that area,
He doesn't
Park Street
know
is
the
just
area
off the
either.
grocery store on
Trust
Lowell.
her.
Then after a
You
quarter
do not
mile,
trust
take the third
anybody
or fourth
in
left
this
onto
room.
Fish Hatchery Road.
You
If you
should
would reach
not
Haywood
be
Drive,
listening to her.
you've gone too
At
far. Make a quick
She
right
has
onto
no
Fish
idea
Hatchery.
where
and
the
big
library is.
green
She's never
building
been
is
there
the new
herself.
library. It's right next to the old library, so you can't miss it.
You
So
can't
beautiful,
miss it.
so
You
big,
cannot
great
miss
common
it.
spaces, and
She's
incredible
still
views.
looking at you. How was that experience for you?
Terrific.
Yeah?
I saw it.
Mind bending.
Deer in the headlight.
Yeah, mind bending.
Can you get to the library?
No.
Can anybody in this room get to the library? No. No. Can you get to the library? Right.
Probably.
Right.
Right at Fish Hatchery. It's a big green building. What's
Did-
wrong with that?
When you looked at him, did you see anything that indicated
Yep,
to you
deer in the
that he was
headlights.
deer in the headlights? Right. So probably struggling to focus a little bit, right?
Oh, yeah.
Yeah.
Holy.
Yeah. Yeah. Right. Did anybody else notice anything, or did you have any feelings of what did that bring up for you going through that? Anxiety. Yeah. Yeah. Yes. Somebody did cry on Friday. Yeah, and I mean it is. It's hard to think. Yeah. No, and so this is thank you very much. I appreciate. Can we get a round of applause for her? So this is one of the favorite activities that people go through in mental health first aid. This is in both the youth and the adult version. I think this activity is a great example of what's at the core of this program is really building that understanding and empathy of what people are going through. Because when we see a physical challenge, we can see it, right? If I'm physically injured, you'd be able to see it. You'd be able to have a little empathy and understanding because you can see what I am going through, but we can't see those with mental health challenges. And so activities like this can give us that opportunity to learn what people might be struggling with. And then we can, be there and be their support and help really validate what their experience is. So thank you for your time. Thank you again so much for letting me do that
Kendra,
activity.
can you try to then relate what we just did here to what's going on in the classroom when we have a child coming into the room that's dealing with an environment, a behavior environment they're coming from, or there's other issues going on within family or with their lives or with another student? What are their chances of really achieving in that class academically?
Yeah, they're going to struggle a lot, right? Because we know that, especially depending on if there's a situation going on either in the classroom or even if they don't feel safe at home, if we don't feel safe in general, it's very hard for us to learn. And if we're bringing in, experiences from home, or again, if we're struggling with another student that's in our classroom, it's going to be very hard to concentrate. Our mind is going to be focused on that situation and trying to stay safe versus actually trying to learn what's happening. So again, we might be seeing these as children acting out a lot of times, right? That we label them maybe as problem children or somebody that's just misbehaving. And that might not be the case. It could be that they are struggling with their situation and they need, again, a little bit of us to understand what they are experiencing so that we can then help them. Okay, how can I create this safe environment in my classroom so that they can be in a situation where they can learn? Yes. Oh,
Yes, Representative.
Thank you. 2 questions.
Yeah.
One is, you had mentioned ALGE
yes.
was an acronym for an action plan.
Yeah.
What does
Yes.
that stand for?
Yes. So ALGE, the A is for assess the risk for suicide or harm. L is listening non-judgmentally. G is giving assurance and information. We sometimes call this hope with facts. So usually people need a little bit of hope, but we don't want to give them false information, right?
Right.
So mental health first aid really goes over a lot of statistics and facts so people can be prepared with those. The first E is for encouraging appropriate professional help. And so again, we work to make sure that we have local resources available so people know, okay, this is your local community mental health center, or these are some other places you want to go in your portion of the state, or we have other national hotlines and things at the ready to share. And then the last E is encouraging self-help and other support strategies.
Great, thank you.
Yeah.
And one other last question is, do you differentiate between behavioral health and mental health? And what
I tend to
kind
use-
of signs might be the difference
No, so in the course, no, they'll talk about both of those.
together?
Yeah, together, yeah. So then you'll see, maybe what are some of the physical signs. So that could be, somebody's looking more disheveled than they usually
Yeah.
do, right? Or then behavioral health would be some of the things like not eat, your changes in your eating habits. Mental health would be, there's signs, which are things that we can observe like that. And then there's symptoms, which are the things we can't observe, which would be like, what are the cognitive thoughts that people might be
Okay.
telling themselves? So then we know what some of those are, again, when they're early on in the crisis and they're worsening, or, when they're in crisis mode, what are some of the common thoughts people are having? So then we know, okay, this is what people might be thinking at this time, right? If they're in crisis mode, they might be thinking about suicide. So we need to be asking them specifically about that. So it does go over both of those. Yeah.
Representative Myler, do you have a question?
Yes, thank you. How do you teach people to listen?
To listen non-judgmentally or listen in general?
Just listen in general without, I guess it would be a non-judgmental thing, because one of the problems we have is that everybody is supposed to have an opinion. So I think it's very difficult for people to just listen to what somebody's saying. What kinds of programs do you have to teach listening skills?
Yeah, I would say we don't have a program that teaches just listening skills, but this one does spend time practicing listening and going through time to have somebody talk about maybe a situation they're going through, not necessarily a crisis or a mental health challenge, but they practice that active listening where you have to repeat back what the person just said. I would think that's actually embedded in some of our youth programming too, that we know it's an important skill. So whenever we can in workshops, we're going to practice active listening because it's a good skill to have and it can be challenging for people. With the listen non-judgmentally piece, that is a part of it as well, that there's an opportunity to look at what are some statements we might say that are not helpful and what are statements that we could say that are helpful. And so that goes through that practicing again of I'm trying to just listen to somebody and have them tell me what's going on with them and how can I be a part of that conversation and not give my opinion because my opinion might be saying something that's not helpful to them. So what can I say that instead validates what they're saying to me? Yeah.
Yes, our guinea pig over there.
Yeah. Yeah.
Thank you, Chairman. Thank you for your presentation. Couple quick questions on the youth mental health first aid
Yes.
piece.
Yeah.
You said that's an 8-hour course?
Yes.
Okay. Is it available online?
Yes.
Okay. And then the third one, about, if any, how many school districts in the state have participated in this or are participating in this in terms of training the faculty?
Yeah, so that's a question I unfortunately don't have the answer to. Part of it is because we are not the only ones who offer the course. So there could be, we have several community mental health centers who also offer the course and they have different funding than us. So we might be talking together, but we're not necessarily sharing that information. So for example, Manchester has a very active mental health center and they also have another organization that does youth mental health first aid. We pretty much pass off our Manchester requests to them because they can meet those.
Sure.
So I'm not sure on that, unfortunately.
Okay.
Yeah.
Thank you. Thank you, Chairman.
You're welcome. Further questions? Yes, Representative Damon.
Thank you, Representative Woodcock, for asking 2 of my 3 questions.
I saw your notes.
Does the online version of the first aid course have an interactive component, for example, with practicing the active listening?
Yeah, so what the online course means is that there's also a blended option. So participants do 2 hours of it by themselves first, where they're watching some videos. They do a little kind of knowledge check quiz, and they learn the basics of the algae plan. So they can do that on their own for 2 hours. Then the other 6 hours is led by a trained instructor. That portion can either be in person or still online. And so that's when they get the opportunity to practice some of these skills. So again, it'll go through some different scenarios, and then they can start saying, okay, here, I've watched this video, we've read the scenario, let's look at what are some of those signs and symptoms that somebody might be experiencing, and they actually get to then practice the algae plan together. So there's only 2 hours of it that's really solo, and then the other 6 is with the instructors and other people in the course. But it can still be done over Zoom. We do most of our classes over Zoom right now. Yeah.
Thank you, Sharon. Just a quick, is there a fee to this?
It is free right now. So thank you to the Department of Education for funding it for us for the last 2 years. It is currently free. And so we're hoping to be able to continue offering it for free.
Great, thank
So,
you.
yeah.
Thank you.
That was a question I was going to ask too, and Melissa's back there, and maybe the department can help us out with that. I don't know whether I should be calling you doctor with the PhD that you have, but it's really amazing to me that we have the cooperative extension service out of the university system now. I always thought that was dealing with soils and birds and the wildlife,
Yeah.
but now it looks like you really dug out and are challenging us with these areas of need.
Yeah.
And how well is this program, is this operating as a silo? Are you working in conjunction with the community mental health centers and with DOE and others? Is there any way of tying all this together?
For specifically mental health first aid, or?
Yes,
Yeah.
yes.
Yeah, no, we are working. So we also just received a SAMHSA grant for the adult mental health first aid, and several other organizations in New Hampshire also received the same grant. So we're working together so that we're not not competing for each other and that there's not overlap, but we're also learning from one another on how we can, work together to increase our reach. So for example, Manchester's Community Mental Health Center has very specific organizations that they have to meet for the grant. They might have requests that they can't meet because of capacity, so they come to us so that we can try and meet that need that whatever organization might be having. Same with the Department of Education. They know that we are, doing mental health first aid for the youth version. So I have my contact there regularly sending people to me to say, hey, UNH Extension can help you get trained. So we're working with those partners as much as we can to help meet the needs across the
Thank you,
state.
Kendra. I'm going to try to get the questions done by about 10:30 because I think, Melissa, do you have to be out of here by 11 today? Yes. Okay. Go for it, and then Mel.
Just a question about the book.
Yeah.
If people are doing that online, do they have the option to order the book? Is that free or?
The book, they get an electronic
workbook.
copy. And so they could order the book, I think is $25 if they wanted a hard copy, and we can help people get that. Unfortunately for us, because you get an electronic copy, if we buy the book, we're technically paying for you twice for the course. But we try to work with people so that they can get what they need. That's the benefit of doing it in person. When you do it in person, you're able to get a hard copy of the book because we know a lot of people like to have those. Yeah.
Mel.
So this is primarily focused at adults, or are students also involved? I mean, I'm concerned about the issue of students who are not engaged in the whole issue of active listening or dealing with their peers and problem solving, et cetera. So does this have any relationship to student engagement?
So the youth and adult versions are all for adults to take them, and for either adults to support other adults or adults to support youth. There is a teen version that's for for grades 10 to 12, where they then learn similar skills. So Dover High School has been a great example of that they've been implementing it. It's about, the course is shorter. I think it's 6 45-minute lessons. And so they do those about once a week, or they might spread it out a little bit more so that they can have time to really learn and reflect on what they've done in there. So then it gives teens that opportunity to practice things like listening, and then how their goal is not to, they can't provide support for their peer, right? They're not trained for that. It's just to help them in that moment and say, I know this adult at our school is trained in youth mental health first aid or can be a help for you. Let's go talk to the school nurse, or let's go talk to this librarian. So it's helping them just quickly in that moment there, and then getting them to an adult who can help support them.
Representative Luno?
Thanks. That actually, I think, touched on what I wanted to find out about. Maybe as this work session proceeds into the fall, if we could get some, expertise from Dover.
Yeah.
Or any other schools that are implementing the 6x45.
Yeah.
I'm sorry, 6x45 team.
Yeah.
Curriculum. That could be.
Yeah, I think there's a lot going on. I didn't even know you had something going on in Haverhill.
Oh yeah, we've done some meetings
And
there.
so I think this is a good idea that we do pull people in from the schools and just incorporate this into a book of knowledge here. So when we do make some decisions how and we're going to handle all this, it's important. Patty, did you have something?
I just wanted to say, to throw off that in Manchester, I know the mental health center also trains the fire department and the police department, which helps in the way that they respond to calls too. So it's not just school related. It's good for all responders.
It is, yes, thank you. And mental health first aid has actually made modules specific for fire, EMS, public safety officers. And so we are seeing a lot of communities gaining more interest in doing that, because as you said, it changes how they can respond to crisis moments, and they're just getting the knowledge that we need. So we're really excited to see so many of our public safety officers interested in wanting to do the training. Again, Stratford County they have multiple sheriffs that are trained to deliver the program. Their whole police department has been trained. So they're another just really good example of that. So yeah, thank you.
Thank you very much, Kendra. One last question. Throw it up there either.
I'll also make sure everybody gets my card. We'll come back and pass this around.
Representative Hall.
Yeah.
I was just wondering if you targeted your audience, is there any research on someone for self-help? Let's say you end up being the person that takes it, but you're suffering from mental health issues yourself. Have you gotten any feedback?
I haven't gotten any I would say anecdotally, yes. From people who I know who have taken it, but I don't have any hard research, and I don't think I've seen any from the actual program or National Council for Mental Wellbeing who designed this program. But that's a great question. I don't think that they've looked at that yet, but I would say anecdotally, yes, for sure. It's a benefit, because then you get to know your own signs and symptoms,
That's
right?
what I was thinking.
Yeah.
Thank you.
Great.
Thank you very much, Kendra.
Yeah, thank you.
And, we really appreciate your coming down and sharing this. It's been very informative. Okay, so the next person, the Department of Education, do you have others with you? They're all welcome to come up.
Melissa White, Division Director for Learner Support at the Department of Education, and I have my colleagues here with me.
Thank you.
Kelly Rambo, not Division Director, Bureau Administrator for Wellness and Nutrition.
Rebecca Fredette, Bureau Administrator for Special Education.
Oh, you did make it today, Rebecca. Congratulations.
I might have to scoot out, but I'm.
Okay, great. So we have some folks here from the department that have a wealth of knowledge. And, I was briefly on the phone with Melissa yesterday. And I know that when we had the bill first presented to us, there were a lot of questions regarding, where we place mental health in our statute language. How does MTSSB relate to this? And the questions went on and on and on. So let's just try to listen to what they may be imparting to us right now, and then we'll go with the questions and answers following that. That good?
Sounds good. So currently, RSA 193E2A, substantive educational content of an adequate education, has health and wellness education. And then when we get into the Ed 306.40B2G, health education, then is a little bit more explicit about what is included within that health and wellness education. And mental health is specifically identified as a component of K through 12 curriculum in health education. So it is currently already a requirement to include that curriculum in your health and wellness education program. Our current standards for health education right now are a tad bit outdated. 2003 was the last time that was done. Currently at the national level, they are in the process of updating the national standards. Once those have been rolled out, then the department is going to go through the process of gathering our constituents to go through our own internal updating process. But we want to make sure we include those national standards because we've gone through in the past where we've gone through and updated our standards, and then nationally standards get rolled out, and then we have to kind of go back and do a lot of matching up. So that is why you might look at our current health curriculum frameworks, and they have specified mental health education and what that looks like at the elementary, middle, and high school level. But there is some outdated language. There is some things that need to be included. But I noticed when we looked specifically at the language that was put into the proposed legislation, when we're looking at anxiety disorders and going into a kind of that level of specificity, that's actually included in the existing frameworks at this time. So I think that the department's plan was just to move forward with updating those frameworks so that the school districts can then have that information, use that as they're looking at their curriculum that they want to adopt in order to meet the standards. But right now, school districts should have mental health curriculum that they have implemented and are teaching in our schools, K to 12.
Are there any questions at this point? Okay, go ahead, Representative Balboni.
Thank you, and thank you for taking my question. You mentioned that schools should have them. How do you, are there specific curriculums that are recommended at the DOE and they can choose from, or are they just coming up with their own?
So this is where it gets a little bit tricky because there is a statute that says the Department of Education and the State Board of Education are not allowed to dictate a curriculum. So we cannot choose a curriculum and say you have to teach this. However, we have the frameworks, we have the standards, and then at the local level, it's in statute that they're responsible for determining which curriculum they would like to use in order to meet the standards. Currently, we do not have anything specific for health education that we put out as a recommendation. It can get a bit challenging to put out recommendations for curriculum because then you have a number of vendors, and this is across all of our content areas, like, we'll put our curriculum out. Well, you put this curriculum out, ours should be on there too, and then it gets to be a pretty exhaustive list. And since that is determined at the local level, we usually leave it to the local level to determine what they want to use in order to meet the standards.
Yes, Representative.
Would it be helpful, knowing the national standards are being revised, and our framework now is 20 years old, would it be helpful to put a survey out to schools to find out what they are doing? Or is it better to just wait to see what the nationals are and send it out? And
we could do that. We've done that in the past when we're surveying some of our other content areas. Like,
yeah,
what are
I'd
you
just be
currently using, just
curious
to get an idea of what's most widely used. And we've done that in the past too. If we're looking at, particularly during COVID, if we're looking at purchasing or like Discovery Education, how many school districts are out there using Discovery Education? There's a lot that want access. It's worth it to buy a state level license for all schools to be engaged with. So we could definitely do a needs assessment on that piece, survey the field as to what they are utilizing. But
If you do that, can you also be determining if they're training people to import? We have the curriculum, but the instruction is a part that I'm really concerned about. Who is the one is providing this instruction? Is a classroom teacher who just came out of UNH prepared to deliver this program? Is it a nurse within the building that's been there and is familiar with it? I'd like to know in the districts how this is being conveyed, imparted to students.
And I think that's something we could include in our query as to how, who is responsible for
So-
teaching that curriculum. I know in some
Yes,
school
go ahead,
districts it's
Representative.
physical
It's-
education teachers, some it may be.
That's actually in the law, 18910 Roman 1.
Right.
The Department of Education shall survey school districts biannually and receive reports on compliance with this section.
And we have gotten that report back, and I was amazed when I looked at that report that there are some schools, even high schools, that are putting, no, we didn't touch that topic, even though it's required in statute. And so I think that was going to be a September deal that I was going to bring up, because there's a lot of, that information that you provided us is really showing there's some holes.
Right, and I think that's similar to something we discovered a couple of weeks ago with another compliance report that hadn't been put together. So maybe getting the last several of these, so that and maybe a trend. Is it getting better? Are we getting more compliant, less compliant?
I think that's all good stuff we should be familiar with. Those surveys have been done annually, is that correct?
I will double check. It's either annually or
Biannually? Yeah, biannually. Yeah, so we should have some information, but it's only as good as what's being entered by the school district.
Correct.
So, and there are those districts, which it's very amazing, there's some large schools saying we aren't doing it in all areas. Yes.
Thank you. The national standards that you said are currently being revised, and if I got this right, they go back to 2003, or our standards go back to 2003?
Their standards as well.
So they haven't revised the mental health
Correct.
education standards for 20 years.
Exactly. And it's my understanding that they were in the process of doing that, and then, of course, I don't know if the excuse is just being used that it's COVID, but then it's like, oh, okay, COVID, that set us back. But they're anticipating within the next year, at least according to their website, they're anticipating to roll those out within the next year.
Yes, Representative Tanner and then Representative Cornell.
Thank you. Thank you for taking my question. I'm wondering when the state school board or local school boards give approval to schools, if they consider whether they're meeting the requirement for health ed or any other part of the adequate education standards.
That piece of it, I may need to check in with Caitlin Davis's division, the Division of Analytics, because they are the team that collects the data. They are the team that does the school approval component. I do the standards and the content, and they handle that piece, but I could definitely check in with them on that piece of it. It's my understanding that the schools, when they go through the approval process, they do have to provide their curriculum, but I could be, I don't know if we actually collect the actual curriculum or just the name of the curriculum. Oh, we're using, so-and-so for our math curriculum, or if it's down to that level of specificity. I don't know if we actually look at and then match up to the actual standards, whether all of that's addressed.
Representative Cornell.
The new 306 standards change all of the shall requires to may requires. So if those pass, no one will have to do anything, correct?
The new ED 306, take those elements out.
It will say may.
They have the topic, the subject, if you want to call it that, but then all the areas of health, for example, if you look at what was in the oversight committee there, it listed under the ED 306 that mental health, I think it's item G on there.
Correct.
Is to be taught in schools. From my understanding, of course, those new rules are not complete at this point in time. They're still going through the hearing process with the public. Yes. So that has to come back, and I guess the state board has to take a look at that. But I'm concerned that if you take mental health out of G there on 306, where else is it mentioned in statute? Now, as a previous member of GELCAR, we always had the rule that the rule has to reference a statute. If it doesn't reference a statute, where is the state board coming up with this requirement? it basically becomes really an unfunded issue. So we are concerned that, by taking it out, then it's in this, and I think that's where Senator Waters it was when he put this together, saying that it's an issue in the schools. How do we ensure that it's taught in schools now, or at least referenced? Because we don't, whether it's taught or not, that's a local thing. And unfortunately, that I think is very characteristic of a lot of different subjects in this state in terms of the department really, either one, not having the staff to dig down into the schools. And that's what we were looking for, Dr. Green, Nate, to try to get more analytics support. Unfortunately, that didn't make it into the budget. And so,
And I think too, if we look at Ed rules for 31001, there's this component in there under the daily physical activity program being required in schools, and then there's this component of mental health that's in there. I think that it does give schools leeway, but by having it in that physical education piece, I think then that kind of cues administrators to think, oh, I've got to stick it into physical education. Does it belong with physical education? Maybe, maybe not, but it's kind of inconsistent as far as where it's placed throughout some of our guidance for the schools as far as the rules come around, and then the statutes as well. So I think clarification.
Representative Myler and then Representative Cascadden.
If that's what we want, if we want to specify what it is that should be taught in the schools, then we have to be clear about where we put it.
And I think that's an issue for this committee.
Yeah.
Representative Myler?
Yeah, I understand and thank you for taking my question. I understand the issue of curriculum and mandates, et cetera. The question that I have is the department concerned about the mental health of our students?
Absolutely.
And what are the, thank you, and what are the mechanisms that the department uses to gear the mental health of our students? And what is the mental health right now as we end this school year of our students?
Thank you for that question, because it gives me the opportunity to kind of tout some of the programs that we are doing. And I think this is a part of the discussion we also had yesterday, as far as there's, a difference between mental health education, as far as we're educating all of the students on mental health, how to take care of your mental health, how to be aware of that. Then there's this component of serving those acute needs, or the needs of students that are presenting with mental health needs. And so two different areas, and a lot of our programming right now to do with, MTSSB, Youth Mental Health First Aid, a lot of our programs, the Office of Student Wellness, as well as the Bureau of Special Education and Instructional Support, are looking at how do we do programming holistically to meet the needs of students. We want to look at those acute needs, MTSSB, so that the students are getting that Tier 2 and Tier 3 intervention supports, getting access to some of those higher level professional services that need to be provided by those experts that have that experience in that field. In addition to building those resiliency factors, because we talk a lot about serving acute needs, but we have to work on building those resiliency factors. And the biggest part when we look at prevention and supporting students' mental health is having that connection to community, having that connection to being a part of something. And so when we look at building programming, we just had the fortunate experience this morning to have our junior ROTC from down in Hudson talk about how ROTC has impacted the lives of students and how they were able to feel a part of something, and now they have leadership skills. They have responsibility. They want to step up and give back to their community. So having those various opportunities holistically for students to be able to choose whether they want to be a part of equine therapy, or they want to be a part of a sports team, or they want to be a part of robotics, making those available so that it's not just dependent upon, being in a larger school district and having access to those opportunities. So I think we're looking at those resiliency factors, the mental health education for Tier 1 or all students, and then that MTSSB, and kind of offering that all together. Because if I look at our COVID relief funds, it's not just about the academic piece, what can we offer for schools to utilize funds for after school, before school, summer programming that are engaging for the students, they're active, they're communicating, they're connecting. So that those are some examples of the multiple programs that we are offering. But in our bureaus, we usually, as our leadership team, get together and look at when we're offering services, when we're doing a contract, when we're taking in a grant, let's think about holistically how we're going to serve all of our student groups, because we are seeing, and you can weigh in on this a little bit more, Becky, increase in the number of needs for students in addressing mental health needs.
Yes. Well, you know, I know that there are some who feel that schools should not deal with the social emotional issues of students.
Correct.
And how do you respond to those who object to the issue of schools dealing with the social and emotional issues? Some say that's the parents' responsibility, that's a family responsibility, not the school's responsibility. How do you respond to that?
That is a tricky one, because there are definitely perspectives on what should be included, and it should social and emotional health and wellness be offered. I think that it's the piece about education, so that families feel connected to understanding what all those components are, what is included within that social and emotional wellness piece. I think that it's also important to have constituents involved through the process, so that when we're looking specifically at implementing this type of legislation, having those voices, having the schools come in, having families and parents come in, and talking a little bit about their concerns, perhaps if they have that feeling towards this, that they can have that dialogue and be a part of the process. I think that has been our response, because we definitely hear from people that are very supportive, people that are very, very concerned, and we try to balance both, but it really takes all of us to address the concerns and provide the education as far as what is included when we talk about mental health education.
Representative Luna?
Thank you very much, Mr. Chair, and thanks for taking my question, Ms. White. When Ms. Lewis was here speaking earlier, she handed out this from the UNH Cooperative Extension, and on the back of it, it says that 36%, actually it says 36% plus, reported that their mental health, talking about students, reported that their mental health was not good, quote, most of the time or always, compared to a national average of 29%. And so it's sort of a two-part question. Does that reporting, is that reporting consistent with any data that has been collected by the department? And then number two, does the fact that a student reports that their mental health is not good, does that how does that impact their ability to learn?
So I think for the first part of the question, really the only data that the department has to look at is the youth risk behavior survey. Unfortunately, and we've been very vocal about our concerns, is that the data from that comes out almost 2 years after it's administered. So we're always looking in arrears when it comes to that. So it's hard to look at, the 2021 results to see how that relates to 2023, especially with the past 2 years there's been a lot of change in that short period of time. So that's the challenge that we do have. We don't have access to surveying students directly about that piece. But the programs that we sponsor, the programs that we contract with through vendors, through partnerships, through memorandums of understanding with UNH or with behavioral health institutes, they are able to gather some of that data, because they are on the ground working locally in the schools and providing that information. So unfortunately, I can't answer specifically. It's just like with numbers and data that we are seeing increases. A lot of it is anecdotal. And that we're hearing. The second part is when we look at applying for a lot of these federal grants to meet a lot of the programming needs at the local level, implementing at the school level, it gets a little bit tricky because we've had this influx of money and now it's starting to dry up a little bit. When we look at the funding sources for the youth mental health first aid, we had a robust grant that was able to provide that support. And we have that for another year and then it's going away. So we look at, okay, we are able to provide that statewide, please take advantage of it. But then in a year from now, we have to reevaluate and then we have to prioritize. So I think that's always in the back of our minds is how can we braid multiple sources of funding in order to meet the needs. We were lucky enough to get an allocation into HB2 specifically for MTSSB. But again, it's that balancing of what needs are out there in the schools, how can we utilize different ways in order to meet those needs. I know that some of the schools, when they offer a youth mental health first aid training, a district might actually pay for that, and then they'll open it up to multiple community members, multiple partners in other schools. So I think some of the data they were talking about, they could look at specifically what they were offering, but what you're seeing in other school districts or other offerings across the state, we may not have those actual numbers, but it is widespread as far as how they're reaching out.
Mr. Chair, I just want to follow up on that. So I didn't quite get an answer on the second part. So I just want to reframe it a little bit.
Thank you.
And I know you and thanks for your input with regards to grants and things like that to help improve this. But I just want to put this in a little context. Currently, the state is spending close to 3.5 the state, all in, towns, local taxpayers, state funding, federal grants, $3.5 billion a year to educate 165,000 students across the state. And if 36% of them are experiencing, reported that their mental health was not good most of the time or always, so 1/3 of little over a third. So a little over a third of 167,000 would be somewhere about 60,000 students across the state. Want to make sure that our ability to adequately educate these students is proceeding forward in a way that's beneficial for the students and beneficial to the investment, the $3.5 billion a year we spend. So if we're missing out on a $100,000 grant, it would seem to me that we're jeopardizing a significant portion, more than a third, more than $1 billion of our own investment in educating kids. So with that as the backdrop, do you see a connection, or does the department recognize a connection between the ability of students to learn and what their current mental health condition is?
I would say absolutely.
Okay. Thanks.
Representative Tanner.
And I think it's not just my opinion. I think that most research has shown, I have a master's in educational psychology, and I think all of the, if I can think back to the many years ago where I went through that program, that was very much a part of it.
That's good. I want to thank you for that because I think, I'm not trained in this area. And I would absolutely agree with what you said because I think it makes a lot of sense. But I think it's important for the committee to hear that. Right. Based on your professional experience and training, that there is an indelible linkage between the two, and if there are roadblocks in place that make it difficult for the department to help these students learn better, whether that's availability of non-academic surveys, or whether that's funding from the state or federal programs. I think it's important for us to be able to take a look at how to eliminate these roadblocks so that we can do a better job for all of our students and for all of our taxpayers that are spending $3.5 billion a year to educate them.
I'm going to have to leave here in a few moments, but one of the things we haven't gotten to, and maybe perhaps when Jane comes up, you can be asking these questions. I'm concerned about the intervention process that's within the schools. You may have, Rebecca, you may have a student that might be having an IEP need, and you don't know exactly what realm it is in, but obviously something's going on in the classroom the child doesn't look like they're achieving. So the process the classroom teacher has is, do you refer to an intervention team that makes the decision, well, we're going to talk to other teachers that had the kid last year, or we're going to be talking to some of the specialists within the building, or we're going to go to our school counselor or our psychologist and try to discern, where do we go? Do we go special ed? Do we go to some other strategy? Do schools out there today have that intervention process in place, or is the teacher sort of left stranded in terms of how to deal with this child?
So for some schools, they would have the multi-tiered systems of support for behavior that our Office of Social Emotional Wellness supports. So that would be where they're supporting all students, but then they're also looking at those tier 2 and tier 3 students. But within that, you're also going to have a group of students who would also qualify for special education, because mental health is not just a special education issue. It's all students. And so you are going to have a population of students that have special needs, but you're also going to have many more students who do not have special needs. I think you have two systems that are trying to work together to determine, is it just a mental health issue, or does it rise to the level of it's also a special education need that they have to address. So most schools have teams that they go to, that they would refer the student to, that would review all of that information. They review what they did last year, what it was like last year. They would talk with parents to find out what's going on at home. You would hope that all of those services would wrap around to support that student, and then the team would be able to determine if they need some supports through MTSSB, or no, we really need to go to a referral for special education. I think what we're finding is that not all schools have the supports they need for the mental health issues, and that their only recourse is to go to special education. So we don't have the supports we need for mental health over here. Maybe they don't have MTSSB, or maybe they haven't addressed it in their district. So we're going to come to special education because we know they have some of the pieces that will help. So I think for us, that's where we see an increase in the number of referrals to special education and the number of requests for support for students that we may not have seen before, or that may have gone through a different route before.
How many of the schools have intervention teams which are actively involved and have participation from the Community Mental Health Center?
Do you have that?
I don't think we have that data.
I don't have.
We don't have that.
Yeah. Okay. I'm going to have to leave right now, so Representative Mayo is going to take over, and
Representative Tanner.
Thank you. I'd like to talk a little bit or hear a little bit more about the teacher preparation part of this health education. Most schools can't afford to hire just a health education specialist that's trained in that. So oftentimes health education is taught, as somebody mentioned before, by the school nurse, maybe the phys ed teacher, maybe the science biology teacher sometimes gets roped into teaching health. And I'm just wondering what the department, what they see, first of all, as the community colleges, our Granite State College system, our university system, how integrated into that is with teacher preparation on teaching health, or the ability to get a minor in teaching health. I know Plymouth, to my knowledge, Plymouth is the only university that in the state, teacher prep, that actually gives a certificate of Bachelor of Science in Health Education. And also professional development, whether the department is actually providing grants or whatever to give money to local schools to do professional development in the teaching of health education and mental health service, first aid, for example, even though that's free, but the other mental health issues that that need to be addressed in a health education course outside of just providing the curriculum. So teacher prep.
Great, thank you for that question. So with the teacher preparation programs, I can't speak specifically to that because I don't know actually what what requirements are as far as different colleges or different programs throughout our state. That I think we would have to actually do some sort of analysis or survey in order to get that specific information. With the professional development opportunities at the department level, we offer those professional development opportunities mostly through the Office of Social and Emotional Wellness, but we do combine those programs with some of the offerings that we do with our COVID relief funds, title programming. And if a school is specifically looking at doing a needs assessment and wanting to utilize some of their funding in order to support that type of professional development, we can help them to kind of figure out how to use their funding in order to do that if they want to bring that specifically into their school. I know there was one just this past week that was one school that was wanting to bring some sort of leadership training for their students, specifically with regards to mental health supports. And so we're looking at trying to help them figure out what kind of funding sources they can use in order to do that. So I think it's a mixture. Some components driven by the state level, some components driven by the local level, as far as they're seeing what their needs are, what they want, and getting the buy-in of their teams as far as how to move forward, selecting specific trainings and that type of thing.
So what I'm concerned with is the actual preparation of the person that's going to deliver the health education curriculum.
Correct.
And from my experience, which is, back in the dark ages, but the professional development, couple hours on the afternoon or something, or a one-day thing, was more how to incorporate some of the things into whatever you did teach, so that, or your interaction with students, or, if you were coaching, maybe how to handle certain situations. But other than that, I've seen and heard in this committee from people testifying some really bad mistakes people have made trying to do their best in teaching health education. And with the current climate surrounding teaching right now, I think it's really important that we support and try to encourage and also offer opportunities for people who are teaching health, or who have, the biology teacher that signs up brand new and they say, oh yeah, you have to teach 9 weeks of health as well to get this job. Some support from the department, from our college systems to offer them really experienced direction and guidance and instruction on how to instruct health education. And I'm just wondering if that's something that the department could look into, or that might be put on your agenda.
I think it's something we could, do a needs assessment, do an evaluation, and look at whether it gets tricky. And I speak from experience as far as just trying to implement the science of reading at the teacher preparation program level. We have a number of, studies that have been done about science of reading, how, reading's being taught. Half of our kids in the state are not reading at grade level. Even just to rally around and make change at the higher education level for that component has been significantly challenging. So we would really need to have not just the department looking at it, but it would have to be an effort among multiple constituents, our partners in higher education, our partners in the community, at the community level, local education agencies, administrators, teachers. That's something we would really need to have buy-in and want, and everyone being on board to working towards improving that. It's not something that just the department could take on and move the needle on. It'd have to be everyone involved.
Representative Woodcock.
Thank you, Representative Milo. I'd like, if I may, go back and follow up on a question by Representative Ladd when he was talking about the intervention teams. And I think it was referred to you, actually. if there's not an intervention team present, would this come under the category then of other health issues? That's the first, and the SPED referral. And my second question to that would be, if it's determined that the students are not succeeding academically because of mental health issues versus skill issues, perhaps, what's the next step?
So yes, it could be under other health impairment if it is determined that it's impacting them educationally. I think where the issue comes in is that is it impacting them to the point that they need specially designed instruction, because that's the tenet of special education is you have to have specially designed instruction. And what specially designed instruction would you provide, or do they need more mental health services? And how is the school even able to provide that level of mental health services that they need? So that's where you come to determine, is it a special education issue, or is it a mental health issue that we aren't able to support? This has come up a lot when we've talked about the episodes of treatment. That was another bill that came to this committee this year. Was DHHS is trying to support those students with their mental health issues, but then there's no, then how do we make sure that they ensure that they access their education, and trying to support that way, because there's this gap between districts don't have the money to support it, but they need this mental health support, and the districts are trying to support it, but just can't. So it's convoluted. It's hard to explain. But I think districts are trying to address it, and they address it either through special education or they try to address it with outside agencies, but they don't have the resources. It hasn't been something that they've been dealing with to this level before.
Follow up? Thank you, sir. To that point then, if we understand that, even based on the 2-year-old data, but if we understand that a lot of our youngsters currently in schools have significant mental health issues that are impacting their academic performance, and they may not be special ed particularly until after they go through that identification process. Is there anything DOE is doing, or is there anything that the local school, I mean, each school is doing their own little part of things, but DOE is doing as a unified approach to, we have a mental health crisis amongst a third of our youngsters in high school who may not need to go in the special ed system and spend oodles of time and money not being treated well there. No, I don't mean this not well, you know, right? That's not the right service there. What is our next step as a state or as a DOE to get this prominent problem addressed? Because my suspicion would be, if in fact I don't feel good, if I'm not here today, as confused as I was up earlier this morning, then how in hell can I possibly learn anything in this class?
So I think that's what the legislation in regards to multi-tiered systems of support for behavior, that is where that really kind of arose from. And so we are working across the state with implementing MTSSB at the local level, so that schools have our support, but then we contract with professionals that can go in and actually implement. We have a team in-house that goes into the school specifically and will help them to implement MTSSB, but the need is so great that they cannot, just the small team cannot meet it. So then we contract with other partners to go in and particularly look at some of those more acute, some of those more tier 3 needs, and how that can then make connections to our community mental health centers and to those type of resources, so that the students are getting connected with those supports. So I think MTSSB has been the department in the states, in conjunction also with DHHS, on implementing that piece of it. DHHS then brings in, a lot of their wraparound services and a lot of their supports as well, so that we're working in coordination with a lot of it. So it's a community, it's a home, it's a school, all effort for the students. But the MTSSB implementation, it takes time. It's not something that can be implemented overnight. So, I mean, we continue to work on that. We continue to leverage resources to offer it and make it more available across the state. So,
thank you both. Thank you, Ms. Ryle.
Representative Damon.
Thank you, Mr. Chair. So a couple things. Can you speak to how many schools or school systems now have MTSSB? And then I have another question also.
I don't have the specific number, but I can get that information to you. I don't have it off the top of my head.
Can you ballpark? I mean, is it half? Is it 20%?
Yeah, yeah. 10.
I'm sorry?
I would say around 10 to 12 max.
Percent.
Say that again, please.
10 to 12 SAUs.
And 12 SAUs. How many SAUs do we have?
Yes.
How many do we have?
Like
How many
108. 108.
SAUs,
So
100 and some?
It fluctuates throughout the year. I think we're at 108 last, but I think there's a couple switching this
So-
year, so somewhere in there.
by far the majority don't have MTSSB.
They may, in that we just haven't, collected that information. Are you implementing MTSSB? It may be looking like some sort of other, and RTI was another one that was similar. That's something that I'm familiar with. MTSSB is kind of a new iteration of that. So they may have an RTI process that they've implemented in their school.
What does the acronym stand for?
Or a PBIS process, the Positive Behavioral Intervention Support.
Okay.
So districts may have MTSSB, and we're working with that 10 to 12% through the Office of Social Emotional Wellness, but a district could have a PBIS process in place that they developed 10 years ago that deals with behavior, or they could have an RTI process that they began 5 years ago that helps to deal with that behavior. So we're aware of the 10 to 12% that work with Kelly's Office of Social Emotional Wellness, but there are other districts that have different systems in place that we just aren't working with at this point.
Do you have follow-up?
Well, I don't know if it's follow-up. I have another question. So, Ms. White, we talked a little bit earlier in this session. I'm sorry, I'm trying to find my note about this here. About the possibility of surveying, I think Representative Cascadden brought this up. What schools are actually doing with mental health education and whether the current RSAs are actually being accommodated, followed. And it seems like there's a number of answers to the discussion going along that suggest need for more survey that we just plain don't know. Like a few minutes ago, we don't know how many schools have adequate intervention teams. At least that was what I understood. I feel like we need a pretty thorough look at, this is a statement, not a question, sorry. Look at where we're at.
Okay, Representative Dry, then Representative Dry.
And I really apologize. I have to go over to Governor and Council for a number of contracts that I have to get approved. So I really don't want to cut anybody off, but I'm also really, really nervous because I have a number of contracts that I need to make sure get through that approval process.
Can you take one more question, Representative Dry?
Sure.
Thank you very much. One, I'll need those acronyms, PBIS and
Sure.
RTI in a minute. But secondly, just as a mathematician, I'm concerned that the only data you have is one survey. And I'm wondering if there's more real-time things that you're seeing through maybe the MTSSB or things that we can, collate locally or statewide that don't necessarily have to depend on one point of information.
Correct. So that was a specific survey of the students we were talking about. So that question asked about surveying of students, and that piece of it, that's where we use the YRBS because we can't really go in and survey students. We have partners and vendors that we can contract with that can do some of that work at the local level, but we at the department can't go in and do that necessarily. With the evaluation of how MTSSB has been being implemented across the state, we have partnership with BHII as our evaluator for that. So I can send the most recent report, which is going to be December of 2022, on the state of MTSSB implementation across the state. So I can send that to the committee, and then we anticipate having that updated hopefully fall to winter of 2023 to give even more information on that.
Okay, thank you very much. Good luck with the executive council. Jane, you want to
Quickly
come?
give you the acronyms that you asked for, if you don't
Okay,
mind.
okay.
So PBIS is Positive Behavioral Interventions and Supports. And RTI is Response to Intervention.
Thank you for the clarification. Jane, you want to come forward?
Well, Jane's getting up, but MTSSB can take years in a district to get into place. I know Manchester started with one school in 2020, and seeing how that's going, it's gonna go into 9 schools in this fall. And I mean, Manchester has 23 schools, so I think it takes a long time to see how, and it's different in every school, what you have to develop and the resources you provide, so, you know, they may have only 12 that they think are doing it, but some places may be doing it one school just to try it first. So it's hard to tell.
Representative Woodcock?
I just want to close my comment on the last presentation. It's clear to me that we do not have a statewide equitable process to help youngsters who have mental health issues in our public schools.
Yeah.
And we're not providing anything. It's catch and catch can be on each locality, and that concerns me.
Yeah, well, I think one of the things that, once Jane and her group gets through, is to identify the questions that the committee needs to address, and that clearly is one of the questions that needs to be addressed as far as then of what we want to look at when we come back in the fall. So as we look at these inputs that we're getting this morning, I think the goal is, once we get through with the final presentation here, is to say, what are the critical questions that we need to begin to look at so that the resources can be then identified for the school. So hold that and bring that back, okay? All right, Jane, you want to introduce your partners there?
Sure. Thank you very much. My name is Jane Bergeron, and I'm the Executive Director for the New Hampshire Association of Special Ed Administrators, and thank you for the opportunity to have a conversation today. I brought a couple special ed administrators from our membership today. Jessica Bickford is the Special Ed Administrator / Director of Student Services for SAU 53, which consists of Pembroke, Allenstown, Chichester, Deerfield, and Epsom. And Andra Hall, who is the Special Ed Administrator for John Stark Regional High School, located in Henniker. And where? Close. So thank you guys for coming. I'm just going to start by giving you a quick balcony view of some of the trends that we're seeing from our special ed administrators in regards to mental health in New Hampshire, when it is specifically for the lens of special education, and then have the opportunity for Andra and Jessica to share some of their experiences, but more importantly for you to be able to ask us some questions. So just so that you know, we've talked a lot about this being a crisis in New Hampshire. Mental health is certainly a crisis nationally when we talk to our colleagues, special ed administrators around the state. So it's not just a New Hampshire issue, it certainly is national. And over the past 5 years, we have seen a rapid increase in the number of children and youth who are experiencing mental health challenges. And some of the challenges are tied to behavior and discipline, and yet some are those silent mental health challenges that are more related to anxiety, isolation, depression, and just removing themselves from wanting to be in the school environment. The numbers of children and youth being referred to special education due to mental health and behavioral challenges has significantly increased in the past 3 to 5 years. And I think, our colleagues here can share a little bit more about that. And the other thing that we're seeing is the number and availability of private special education schools. We're having a big increase in numbers of kids who are being referred to out of district and out of state schools. And our in-state programs are full. And we're seeing more students who are being referred out of state, which is just a shame for us to have to experience that. We're also seeing that, part of this crisis is the staffing challenges. We've got an increase of kids who are extremely complex, and we don't have the special education teachers that we need. We don't have the school psychologists. We don't have the social workers. The folks that we need to service these people, we just can't get. So that makes the challenge even more complex for us here in New Hampshire. Some of the factors when talking with the regions around the state that we see that are connected to this mental health crisis is obviously the impact of COVID and the isolation that brought to our children, youth, and families. The opioid crisis and substance misuse is connected to all of this, and it's really having an impact on the children and youth in New Hampshire. The research is telling us that social media is playing a part in this in terms of mental health. We're seeing a big shift in terms of the family and home situations. We're seeing more and more students placed in foster placements. Very complex kids ending up living with their grandparents who are not always equipped to be able to handle these children who have gone through a lot of trauma. We are seeing kids who are very complex with mental health needs, moving back and forth between varied families. They're pretty mobile. So that's another factor that's really impacting some of this crisis. We also see, a lot of inequities in terms of our school systems, in terms of resources and supports and interventions to be dealing with this. The other piece of this that I think we've heard over and over is the silos and the lack of intersection between our education system, our mental health systems, DHHS, our Department of Ed. We're all kind of working in silos. We all have our own resources, and it's very difficult for the integration, which is really critical when we think about this crisis. In terms of solutions, there is no silver bullet for sure. We need to have, more systemic interventions. We need more support and training for our staff. We need staff and the resources. As we just heard Patty talking a few minutes ago, multi-tiered systems of support is a systemic initiative. It takes 3 to 5 years. You need the staff, you need the resources, and you need the interventions to be able to really wrap around kids to be able to pull that off. So today in our schools, we're seeing really, really complex kids with really significant challenges that we have never seen before. Our teachers need to be able to have the support and training to be able to deal with that. It's actually starting to create a wedge between general and special ed. Our general ed folks just feel as though they're not equipped, they're not ready, and many of the students, are referred to special education because that's where they can get the help and the support. So it really needs to be addressed as a state, as an entire community of all of us if we're going to move forward. So from the balcony, those are some of the trends and patterns that we're seeing across the state. And before I turn it over to my colleagues, would it open up for any questions if you would have them?
Yes, Representative Patton.
Thank you. I just have a question. You asked about, or you mentioned the mental health being not just a New Hampshire issue, but a national issue. Are the staffing challenges also a national issue?
Especially in special education, yes. When we talk nationally to our colleagues, it's a huge challenge. And because our student populations are becoming so complex and the resources aren't always there, a lot of people aren't going into the field of special education. When we talk to our institutes of higher ed, and I'll just use Keene, for example, historically they would have graduated over 100 special education teachers. This year it was around 15. So we're just not getting people to go into the field because it is tough. It's a tough field.
Yes, Representative Dry.
Thank you. How would we measure success if we, as we attack these different problems? I mean, if we give money for support and training, how would we measure that's the place where, our money's making good progress, or systemic intervention, or any of those categories you just listed?
And I'm going to turn it to my colleagues. I will just say generally, if there is a solid multi-tiered system of support, there is a data collection system attached to it. And it would tell you all kinds of decreases or increases in behaviors, decreases in referrals to special education. But I'll let you guys speak more to that because you live it every day.
Okay, I would say one of my first pieces that I would look for is for our special education numbers to fit into what the standard says it should be, right? So I would refer to the tier 1, tier 2, tier 3 system. And I'm sure some of you have seen the triangle of supports that the majority of your kiddos should fall into that tier 1 system, right? And then your tier 2, you have a little bit bigger of or smaller of a chunk. And then only 1 to 3% of your population should fall into that tier 3 intervention system and support. So a measure of success for I would use for myself and my districts is if we aligned more so where that tier 3 data says we should align, that to me would mean our systems are working and our supports are working for our kids. And I think to mirror what Jane had just said was that if our special education referrals were to be at what I would consider more typical, just for one example, one of our programs in our district had over 50 special education referrals this year, which is astronomical.
Yeah, I had heard a stat recently that our tier 3 is about 10% right now. So that's kind of where you would benchmark it off of that and move towards that 1 to 3%.
Representative Damon?
Thank you. So could you comment further on students being referred into special education for mental health services that, and correct me if I'm wrong here, it's sounding to me like these are referrals that would not conventionally have been special education referrals, but because of the lack of services being otherwise available, a student who would not generally have been considered needing special ed services is getting referred in that way. Is that correct? And could you comment further on that?
Do you want to speak to that?
That's true. It's because of the lack of services. I mean, we have kids that are on wait lists for 2-3 years for counseling services, and that those counseling services, in order for them to get bumped up in the system, they have to, I had a kid who had to go sit in Concord Hospital for 10 days to get bumped up on that list to get the support that he's needed for 2 years. So, and still ended up discharging because he was okay, right? And didn't get those further supports, but is bumped up on the wait list at least. So I guess something was accomplished within those 10 days.
And I would say to add on to that, we've got a significant amount of kids who need therapeutic supports that schools don't necessarily have those types of counselors on board, right? That would be like your Riverbend Mental Health Center that has those kind of counselors involved. And I think families feel hopeless sometimes and want their kids' needs met because they see what goes on at home. Sometimes we have extra supports at school that we may not always see the same things that parents are seeing at home. The kid may fall apart at home, but is able to maintain during the school day because they've got dozens of adult supports or other services they might be getting through a 504 instead of an IEP. So I think sometimes families feel helpless, and maybe teachers do as well. And so that adds into those referrals because they know they need something and they figure maybe we can try special education and maybe that will give us something. I will say I tallied up our number of emotional disturbance identifications, which have gone higher in the last handful of years, and we're at 46, which is a very high number for kids identified as having an emotional disturbance or disability.
Yes, follow up.
If statewide we were to have more comprehensive mental health education built into the curriculum vigorously and starting from a young grade level, would you see that changing some of this over time? In other words, would there potentially be less students who have mental health needs?
I'll hit a knee-jerk reaction to answer, I guess. And then maybe Jane, you can fill in where I need, but I think that's only one piece of the puzzle. Yes, that would be helpful, but I think there's a bigger picture of better communication and collaboration between mental health providers, doctor's offices, so primary care physicians, and schools that is currently missing or lacking, that needs better alignment between the three of those.
Representative Luna?
Thank you, Mr. Chair. I like the sound of that. So what I'm hearing is that special ed referrals from MTSSB or other programs that may be in the school are happening because other resources are not available. Is that correct?
I would say so. I mean, I think that everyone's grasping for straws. Once they reach that level, they're grasping for straws. They're just trying to get something. And special ed has a system that's in place, so that's something that they can land on.
Okay, and that's my follow-up on this. So what does I mean, I think of special education as IEPs and meetings with families and with principal and how does special education get involved as a surrogate for other therapeutic or services, and how does special education effectively help the student effectively help the student?
I mean, we know in special education, in order for a child to have an IEP, there's a specific process and legal timelines, and we have to go through all of this. And the students that we're seeing being referred do have significant mental health and behavioral challenges. And we really rely a lot on our school psychologists. They're, take the lead in doing these evaluations, and it's the team that decides whether or not the child's disability is really impacting their ability to learn. And in most of these cases, the disability is drastically impacting the child's ability to learn. If there were more resources, maybe they wouldn't have gotten to that point. And so, that logistically and legally, they meet all the requirements and they get an IEP. So that's basically how it happens. Does that help?
Well, and a follow-up on.
Let me follow up on your question.
Okay.
First.
Yeah.
So the query I would have following David's question was, how do you ensure that special education services don't become a dumping ground for other emotional issues that may have? I mean, I think it's kind of related.
I think that's absolutely related, and I think the other related thing is special education services directed towards treating the mental health condition or modifying the education program to line up with to line up with the disability, because to me that doesn't sound like the optimal solution here. I mean, mental health is different, right, than physical and developmental disabilities. Is that?
It can be until it manifests itself to a point of that.
Right,
so I
right.
think that point is that, if we had the availability or collaboration of services from outside providers or additional services in-house that could have treated that student through the MTSS system or the tiered intervention system that schools have in place prior to that, it wouldn't have manifested itself to the point of a significant disability in the classroom setting.
And I think that goes right to Mel's.
Yeah.
Yep.
Yeah, I think that another thing it goes back to the staffing issue is that all of our school psychologists are testing all day long, and they're not able to provide that tier 2 or tier 3 support that they're also in schools for, because they're only one person and they're doing all this testing because of all the referrals, and so that they don't have the time to spend it with the kids providing those preventative services. So that goes back to that staffing issue.
I think one thing I wanted to add on from, I think, your question earlier is like, what's special about special ed? It's a wraparound. That's when you get the outside providers involved. That's when you get that more collaborative, small group, individualized attention for these kids who need these things, including mental health, primary care physicians, DCYF, other agencies that maybe could help or are involved already. Special ed is kind of that piece where you're forced to get all those people together, which really makes a difference for a lot of these kiddos.
Okay. Got Representative Woodcock and Representative Lakis next.
Thank you, Chairman. I had two questions. One, I'd written notes just showing Margaret. The school psychologist, to me, it's sort of like a misnomer. Everyone here, you have a school psychologist, yet I'm here you're saying what I have seen, for been in the business a while, that they're a testing, evaluation mechanism. They're not a service mechanism. They're not a therapeutic mechanism for the most part, particularly now with the number of folks you have coming into the system. Would that be accurate?
Well, they're supposed to provide all those services, but the priority of need is becoming the testing.
Just testing evaluations to determine that. Okay, follow that. Thank you, Mr. Chairman. The second part was, I'm not someone who used the word dumping, and I don't think dumping is the correct session word, but my concern is that, as Jane said, that the general education population of faculty don't have the capacity or skills, and then you take the behavior disorders and throw them in the regular classroom, it makes it more difficult. And I'm thinking, and if I'm wrong, please stop me so I don't go down the wrong track here. But the numbers of mental health issues that we're seeing migrating to the top now are significantly higher in the last, say, 2 or 3 or 4 years, the last 2 or 3 years particularly, than were the last 5 or 10 years. Would that be a fair assessment? If that's accurate, then should we start thinking on a wider scope of maybe the schools as a teaching, learning, student body program have to start looking at providing mental health services for students? I mean, our guidance counselors, for the most part, from my perspective, and no disrespect to guidance counselors on the committee, aren't trained in significant mental health issues, the depth of the problems, nor do they have the sufficient numbers in the schools to deal with that. So I'm wondering if maybe we need to start looking at a different model of bringing community mental health types of services into the schools, not abandoning them because they surely have full with what they're doing right now, but I mean as a part of the school system, and maybe relooking how he staffs kids, particularly during this crisis period. Is that something that's been dialogued amongst the professional folks in that area, or am I way off base?
No, you're right on target. And I will say that Riverbend currently does have a program where they go into some schools, and there will be a counselor who will provide services in the school district setting. However, there's a limit to what kind of service they can provide in a school setting, because kids with severe trauma or things like that, they will not treat in a school setting because of the type of counseling service that's needed and the recovery time after that session. So they typically, when a kid has an intense session with a therapist, they need some time to kind of debrief, soak it in, and not be thrown back into a classroom full of peers that might trigger them all over again. So that is happening, but it's pockets.
Representative Lakis? Oh, did you want to respond?
I would just add, I think we would certainly support that kind of concept and actually having mental health centers in our schools. So it's not just, if the family is dropping off a child and they need to have that support or look for resources, to have those kinds of things under one roof, and more connections with our medical world also, I think we would embrace that kind of thing.
I am lucky enough to have a tier 3 mental health support system in my school, Effective School Solutions. They're a contracted service that come in and they provide services for up to 20 students, mental health services that include individual therapy, group therapy, and family component, which I think is probably the most important piece of that is because of that real true wraparound for students. But because it's a contracted service and they have their own program, there's a lot of red tape for any. Once we cross into the medical world, there's a lot of red tapes, and so that's the other barrier sometimes.
Can I just ask for one fault to that comment?
One more, yes.
Just to that comment. So the youngsters that are being serviced by these professional contractors that are coming and helping, are those youngsters typically on IEPs, or these youngsters who just have mental health or special behavioral issues that are separate from that?
There's some that are on IEPs, but not all of them are.
Okay.
Some of them.
So it's not an IEP. Okay,
Yeah.
perfect. Thank you so much. Thank you.
It does come through our MTSS process
Right.
through referral.
Thank you.
Representative Lakers and Representative Cornell.
Okay, I have now 3 questions. They keep growing. I'm curious, my understanding of MTSSB is that once you get to tier 3, you're not doing that in the school, you're doing that out of the school, right? You're sending the kids to one of those services that's not in the school. And maybe I'm wrong about that, but what I'm wondering is why we're trying to do all of our mental health services, I guess, in the school as opposed to outside of the school, as opposed to working with the kids and the families and setting them up with something in the community where if it does, I mean, it can take a long time, right? Sometimes it can take hours, counseling sessions that are fairly long, multiple times. And why are we trying to do that in the school setting instead of in addition to the school setting? So that's my first question. Sorry.
I think that's exactly what it needs to be, both in the school and in the community, because the kids spend a significant amount of time in school. So there needs to be some support when they're in the school system, when they're in the school setting, but they're also, many of these students need a full wraparound.
I'll just add on to that to answer the first part of your question. When students get to that top tier of intervention support, the majority of that support is actually in-house. It's not necessarily us sending kids out. There are very minimal students that we choose to move to a more restrictive setting. And that ends up 99% of the time going through the special education process and the team determining that we cannot meet the educational needs of that child and they need to go to a specialized school. But that's few and far between. The majority of our kids get those really in-depth intervention supports in the school setting. It just might be that they're being removed from the classroom to access those kind of supports, or they have an intensive wraparound team, and maybe there's a facilitator that's coming from UNH to do a wraparound type approach with that team of teachers and family members and the students.
Okay, yeah, I wasn't thinking of sending them to another school. I was just thinking of in addition to the school time, outside of the school time.
Just to add on to the outside of school time piece too, is a lot of times we do help the families get connected to a mental health provider, but we can only get as far as making that connection. We can't actually get the parent to follow through on the mental health services piece. And a lot of the mental health service providers are in the same position schools are. They don't have staff. And so therefore that kid gets put on a waiting list for 2 years because they don't have counselors who can take that kid off the case.
Which goes to my next questions, which is where I started. You talk about school psychologists and whatever, and I'm thinking, well, yeah, big school districts have school psychologists, but we have an awful lot of school districts that are small that don't have school psychologists. And who deals with these things in those small districts?
So even sorry, go ahead.
I think the vast majority of our school districts have access to school psychologists, even if they're part-time. And when they don't, They contract to have psychologists come in and provide those services, whether they be counseling or evaluations for students.
And I do believe as the numbers of special ed teachers have gone down, the numbers of school psychologists have gone down too significantly.
Okay, so what started out as my first question, which is now my third, is do you see any kind of solution or perceive of anything that's going to grow our number of providers, because that keeps shrinking, and this is everywhere, right? So do you see any kind of solution, anything that can be done to expand that?
I mean, I think that we're competing against, big hospitals that can pay, these enormous sign-on bonuses. That's what we're competing with in the field is that, like, and school nurses are the same thing. Nurses are getting $5,000 sign-on bonuses. Come work for our school. That's not so appealing.
And I think there's a list of about 20 things we could do to get to that point, but I think it's going to take reform and multi-systems working together. So like you guys talked about higher ed, revamping the way that those people are getting trained and equipped to deal with what is happening in the schools and not necessarily what was going on 20, 30 years ago in school settings. It's revamping the way that doctors' offices, mental health providers are working together with the schools, and the way that the state is working and the department is working. I think all those things kind of need reforms to better work together, and then we could see those kind of results. But I think that's a long, tedious process that includes multiple items on the checklist.
Well, you're talking about the checklist. Is it possible for you to write something up and send it to us?
I can make a checklist. But I have my own opinion.
Well, but it's a starting point, right? But apparently it was the idea that only 15 instead of this large number. I mean, how do we deal with that? Because if we're only having a small number coming in, and I'm sure we're having people retire.
Well, I
all
think
those other things aren't going to help that.
related to what Representative Lake is, are there models in other states that could be replicated here?
I don't have that information, but I can check with our national colleagues, but nationally it is a real challenge getting people to go into the field. In New Hampshire is not at all competitive in terms of salary. And with our growing numbers of kids with disabilities and becoming more complex, it's truly a really challenging job. And same with our school psychologists, competitive wise in terms of salaries. From what I understand, those who graduated from Plymouth all left the state. Just because, they could make much more across the border. When they do their practicums, they get paid practicums, where in New Hampshire, that's not typical. It does happen in some cases, but even for their practicums, they will leave the state. We're just not competitive. Resources are tough.
Representative Lake, is she all set?
Thank you very much.
I've got Cornell, Cascade, and Damon. You're all set? Okay, Cascade. And I am also concerned about the time, because what I want to do is to take the final questions. Then I want to take a break and then come back and then kind of focus on some of the questions we need to deal with, okay? So Representative Cascade.
Thank you. Just a couple of questions. First, I agree with a representative like us that mental health therapy really should be done by the specialized fields, but schools need to have the multi-tiered systems of support to be able to manage the student, not cure them, just manage that behavior. But are you finding that the teams or parents are requesting one-on-one ed assistance for those kids that are having difficult functioning? I mean, I used to see that.
Yeah, and we're getting doctors' prescriptions for them.
Yeah.
So
okay,
this is
so
sort of that
that's out of
difficult
control
piece.
too, because everybody wants a private one-on-one educational assistant who doesn't come with the training by all means, and it's a Band-Aid, and it pacifies people because it keeps the student out of the classroom, and it just barely, keeps it under control. But I was curious about that because I experienced that as well. I mean, people want, we'll give them a one-on-one aid. Well, you know what? You're talking, only a $35,000 salary probably, but,
I appreciate what you said. It's a Band-Aid, really, because
Oh,
that person
barely.
is not
trained.
a certified professional,
Right.
right? I mean, it doesn't mean that they're not great. They could be great, but they're not a trained educator. And when you have multiple one-to-ones, you add multiple adults and
Right.
multiple areas for
And you need spaces.
miscommunication, spaces, things like that. And
Yeah.
ultimately, could there be a redesign in the system or more universal design for learning in the classroom, more co-teaching opportunities that could change the need for the one-to-one and not need that, but redevelop the system of education in the classroom and additional supports from mental health providers, counselors, things like that that could help support those needs.
But you are seeing that
Oh, yeah.
as on a rock. Yeah, I mean,
So
that's
we
the
really
cost of the
are
local.
truly getting orders from doctors for IEPs, for
Yeah, that's
one-to-ones, things like that, that
ridiculous.
they may not have. And they're going from the word from the parent, which is
Correct.
okay, and that parent is advocating for their child, which is great. But they may not have the context and the data from the school.
Correct. I've been through that. Yep. Thank you. I'm just curious about the one-on-one increase.
Representative Damon?
Thank you. I'm wondering if the testing always needs to be done by a psychologist, or is there any model where a lower tier provider like an MSW, LICSW, are they qualified to do that testing, and respecting that there's a profound shortage of those folks as well? But just, would that be a way to free up psychologists to provide more of the supports, not just the testing?
I think Andrea's going to refer to our special ed rules. There are certain types of disabilities that require certain evaluators, and that's kind of what we have to go by.
That's my question, yeah.
For each category, there's certain evaluations that need to be accomplished, and then it tells, the law is very clear on who can administer those.
So is it always a psychologist?
For like intelligence testing, yes. For social emotional, it
So
requires
mostly it is.
a psychologist or a psychiatrist.
Thank you.
All right. I'm going to take one more question.
Well, I don't think those other people are any more available than the school psychologists are to me.
One more question.
Just another piece to answer Hope's question is that a special ed teacher can become SAFE certified, right? And they have the capability to do the in-house testing for some intellectual disabilities, right? So it may save on a school psychologist in
Yeah,
terms of.
but it's going back to the special ed teacher piece,
Right, right. Then it goes back to a special ed teacher who wants to be dual certified and do some of the tests.
Okay, one last question, Representative Dry.
Thank you. Could you just clarify what law that is that does that? Is a state, federal, that decides who tests for what?
These are special education rules.
Rules from New Hampshire?
Yes.
Okay, thank you.
Okay, thank you. All right, thank you for your presentation. Obviously, this is a very complex issue. And what I want to do now is I want to take a 10-minute break. And then I want to come back and have a committee talk a little bit about what we've heard this morning and what are some of the questions that we may want to identify and look forward to our work in the fall, okay? So let's come back at about 10 minutes after 12, okay? Thank you for all of you for being here today. We appreciate that.